There are two types of symptoms which the patients commonly report. The first is sensory symptoms. So these are odd extra sensations that appear in the limbs or sometimes in the face. People describe tingling or crawling sensations, and pain is often a big problem. Often poorly localized, comes and goes, flits from place to place, sometimes felt in the muscles or joints. The other type of sensory symptom is a sudden lack of normal sensation. So people can find that they can no longer feel part of their body that they'd expect to feel. So they get a lack of sensation in the face or in their hands. Sometimes they come in with loss of sensation down one half of their body, and that means that they often come in on our stroke pathway as people with a possible stroke. And sometimes they even get told in the outpatients clinics or in the emergency rooms that they've had a stroke. Characteristically, the symptoms come and go. They can last anything from a few minutes to a few days, sometimes weeks, but they do tend to evolve with time. So that if you talk to people about the symptoms and then talk to them again 3 months later, they're slightly different, and 3 months later they're different again, and sometimes over a period of time they become very different and unrecognizable from the first presentation. The other type of symptoms that we commonly see are what we call motor symptoms or movement symptoms. So these again can either be positive or negative. The positive ones are extra movements that people get, so they sometimes come with tremors. Their body is probably one of the commonest, or difficulties with walking, perhaps extra movements, involuntary jerky or fidgeting sort of movements. But I suppose more commonly is the inhibition of movement that people find. They find that they've lost the use of an arm or a leg, or perhaps both. Again, they can come in on our stroke pathway because this can be quite sudden in onset. And they find that they lose the ability to move their limb. It's as if they've forgotten how to move it. It just won't do what they want to do anymore. And sometimes that loss of function is only for a very specific type of activity. So they may be able to walk backwards but not forwards, for example. Sometimes they find that they feel very slowed down. I suppose the single commonest type of symptoms people get is that of fatigue. And often the patients will start with these other types of sensory or motor symptoms, and over a period of months or years, fatigue will become more prominent and perhaps the dominant symptom in the end, and they often end up with a diagnosis of chronic fatigue syndrome or CFS-ME. So chronic fatigue syndrome is characterized by the predominant symptom being that of excessive tiredness, which is really disproportionate to the amount of effort that the person is putting in, and when they do overexert themselves, they find that the next day they're completely exhausted, and it's people describe it as a different sort of exhaustion compared with normal tiredness. They really simply can't get out of bed, and it's characteristically associated with a difficulty with concentrating, which is described as brain fog. Lots of other symptoms can occur, but that is the commonest sort of group of symptoms that you get.